so I think that one of the greatest gifts that you can give your family and friends is the gift of talking and having a conversation about health. And here to help us do that is Dr. Let me get this right, Weingarten.
Yes.
Right? There you go. I got it. He is from Augusta Vascular Center, and we're actually going to talk about a topic that could be causing some people some discomfort, and we don't want that to happen. And so we want to focus today on uterine fibroids, if that's okay.
Perfect.
Talk to me about what that is so people have an idea, because I know when I say that term, it may sound a little bit foreign to some people. So explain it. What is it?
So fibroids are growths of the uterus. They're non-cancerous growths, but they can cause discomfort. They cause problems around a woman's monthly cycle.
Okay.
Extra bleeding, heaviness, pelvic pain. And they can push on organs in the pelvis, the bladder.
Make it a little bit uncomfortable.
Make things uncomfortable.
And that's what I was going to ask you, because they're obviously they're benign tumors. Is that
yes,
a good
in medicine,
way to describe it?
a growth is called a tumor, and
Okay.
it can be cancerous or non-cancerous. And these typically are not cancerous.
Or not cancerous.
A very small percentage of them can turn into cancer when they get really big, but
Okay.
that's super uncommon, but something we look for.
And some of those symptoms, I mean, they seem to me that they're abnormal if they're happening to you because something abnormal is growing in your body, but they're pretty normal in the sense that it's nothing that is going to stand out or be too obvious that you have them, so to speak, besides that discomfort, right?
It gets kind of magnified. So some people that we take care of have a period that lasts for 3 weeks as opposed to a week. So
Okay.
that's like an extreme, but it's not uncommon.
Oh, well, and that could potentially mean that there is a fibroid in there?
Fibroids are there, and they're typically diagnosed with ultrasound. Sometimes they can feel them on physical exam. The gynecologist usually diagnoses them through the use of ultrasound in the office.
Okay. And that's exactly what I was going to ask you. So usually the ultrasounds or the pelvic exams are going to determine whether or not you do have that growth?
Absolutely, and they run in families.
Okay.
A lot of people will know that their mom had them, and they'll look out for them.
So that's one way. Obviously, genetics. Is it hereditary? You know that you're going to have these growths, and so that's one thing to potentially always keep in mind. That if your family member has it, potentially you could be at risk for these. Okay, and I say at risk, and that sounds kind of scary, but a lot of the time they're not cancerous.
Exactly. Most of the time they're not. The vast majority of the time they're not.
Okay.
It's we treat them more for patient satisfaction and comfort.
Okay.
To alleviate some of the symptoms and lessen some of the symptoms.
Yeah.
Sometimes people have their periods are so heavy they get anemic. They lose so much blood that they need blood transfusions.
Yeah.
And so it's an alternative to hysterectomy.
And I was going to say, nobody wants their period for that long. It's already hard enough on women to have it for a week. Sorry, let's be honest. But so there are treatments, and it's called UFE. Explain to us what that is, because Augusta Vascular Center, you do offer it there.
Absolutely.
Okay.
That's uterine artery embolization or fibroid embolization.
Okay.
And what we do is we go to the arteries that supply the uterus, and we put in little particles that cut off the blood supply. It's kind of like pruning the roots of a tree. You don't want the tree to die, but you're causing it to have less supply, and it kind of causes the fibroid of the uterus to shrink.
I see.
And that results in less of everything. There's less mass effect that pushes on the organs, and then there's less blood supply, so that'll cut down on the amount of bleeding.
Now, is this something that will cause you not to be able to have children?
In the beginning, yeah, they absolutely can have a problem with fertility.
Okay.
If the endometrium, where the embryo is implanted, has an irregular surface or bad blood supply, you can't have a viable pregnancy.
Okay, so it's something safe to do if you do have them, but if you're going to have children, maybe hold off.
For the most part, we like to do it after you're done having children.
Okay, perfect. That's
but there
good to
are
know.
some instances where we get asked by the fertility doctors to try to help make the uterus a more suitable environment for the embryo.
Well, yeah, because I'm sure that those fibroids take up space.
They take up space, and they kind of steal the blood supply to what should go to the embryo.
Well, thank you so much for being here and for talking to us about this. It's always some good information to have, and if you have any more questions, you can go to thedishon6.com, visit them at Augusta Vascular Center. All right, don't go